the communication out to the community that we were setting up this temporary shelter. So we were very proactive on the communication side of things. As soon as we saw the weather forecast and we had a plan in place, we pushed it out to, and thank you to the news media for sharing that information. So we used our local news outlets, social media, and direct communication to our stakeholders. We have a community newsletter at the city that goes out to 95,000 people. So we were able to communicate that way. And then we've been communicating very robustly with our CHHS stakeholders. And those are people who are the nonprofits, the providers, people doing the work on the ground, addressing homelessness. We wanted to make sure that those organizations and agencies knew what we were doing so they could get information out to the people who really needed it most. At the end of December 2nd, or as we were closing in on December 2nd, and we knew that first week was going to end, we realized that we needed to extend the shelter, and we needed to extend the shelter. Snow was coming. We weren't seeing those sub-zero temperatures. Snow was coming, but we also wanted to make sure that we gave, that we had ample time to get people connected to services, to those who wanted to continue to be sheltered. And that's what we spent the next week on. We also did look very actively for another space that we could offer emergency sheltering. We extended our shelter through December 9th. And in that time, we were able to do an assessment of the guests who were staying there on Thursday and Friday before we closed. We did a survey to find out how many of them would want to access shelters. About half of them said that they didn't want to go into shelters or didn't want to stay in a shelter. So we were able to move those who did want shelter into capacity within the regional shelter system. And we also found out a little bit more about the demographic. So we extended until December 9th and continued to look for another location, because I'll just tell you that the damage that the convention center sustained during that 2-week period was so great that the PFD says we need to be able to have some time to make repairs before events come online. And so that was another reason we extended, was to be able to try to find another location. Our partnership with the PFD, I can't be more thankful to them, because had we not had this option, we wouldn't have had the shelter that we were able to operate. But during that time, just to give you an idea, the nightly peak range was anywhere between 100 and about 350 guests. On any average, we welcomed more than 300 people half of the nights during that 2-week period. And we saw the greatest number of people come into or access the shelter between 2 a.m. and 6 a.m. We served more than 9,000 meals. We tested guests 3 different times for COVID. We never had a positive COVID case, but we did, as I mentioned, offer isolation space when we needed it, in case we needed it. And we responded to 54 medical calls at the shelter. Paramedics and EMTs were called to the shelter, and we provided 30 doses of Narcan. And for those of you, I'm sure you know, Narcan is to reverse any drug overdoses that were to occur. We met daily, every morning, as an operation to make sure that we were operating things smoothly and to make any changes or shift anything that we needed to do. We also visited, or we asked outreach teams to come to the shelter to try to make connections between guests and other beds within the system. We estimate that 2-week operation of the shelter cost about $400,000. That's renting the space, that's paying for the operators, the meals, the security that was provided, all of that, about $400,000 in that 2-week period. We're getting a running list of damages at the convention center from the PFD right now. That list of damages is approximately $90,000. And during the time we were there, we made 6 arrests for warrants, trespassing, and violent behavior. So as we move on and we talk about the challenges of standing up a shelter in inclement weather, extreme inclement weather, and seeing the type of population that we serve during this time. We're going to be showing pictures too, but this is an extremely difficult population to serve. One of the things we learned was we can't have people coming and going all night long. We really need to set some kind of time limit so when people can re-enter the facility. We need to limit the spaces or the buildings that we use to surfaces that can be easily cleaned. There was a lot of damage to the carpeting, to banquet chairs, to the restrooms. In fact, we had to close the restrooms that we were provided with about a couple of days into the operation because they were so heavily damaged they weren't usable anymore, and we brought in porta potties. We need to utilize professional security because we did have security issues throughout the 2 weeks we were there. And we also need to even do a better job of being able to store people's personal property. But we need to have expectations that are clear to the residents who are coming in or the guests that are coming in so that they know early on what is expected of them and what those hours are going to be. It can be a 24 hours operation, but we definitely need to cut off when people can come and go. And we need to do a better job of connecting the people who are accessing this shelter and shelters moving forward to services that they need. Lots of substance abuse and lots of behavioral issues we experienced with the guests. So we need better connection to services. The usage, the survey that we did Thursday and Friday before we closed on December 9th, Sunday, December 9th, we found that 3/4 of those who accessed the shelter were male, that they were walking to the temporary shelter. That was their means of transportation, although we did offer shuttle transportation for people who needed to access the convention center. So about 92% of those that were using the shelter were singles, about 3% were couples. The challenges again, these are pictures of the inside of the convention center. The $90,000 in repairs basically will be to repair damages to the restrooms, to the carpeting, to the chairs, and to the partitions. The chairs that you see right there, there's about 86 to 90 chairs that are going to have banquet chairs that have to be replaced. We had very nice restrooms to offer, but they became damaged to the point where we had to close them. And for people who, maybe aren't used to being indoors or inside because they've been living outside for so long, many of them use banquet chairs for toilets. We saw a lot of behavioral issues with the population that was served during this time. Toilet seats were broken, mirrors were smashed, holes in the walls, lots of destruction, outlets that were kicked and no longer usable. So all of those repairs are ongoing. The carpeting alone, just the biohazard service crews that are coming in to clean the carpeting is about $40,000. So you'll see that this is why we want easily clean surfaces in the future, and just more security on site for the behavioral issues that we experienced. And we need better assistance when we operate these kinds of shelters. We need help with people to address people who are in altered states. As you can see, this was a lot of the property that was left behind. We provided storage, but a lot of this stuff ended up we had to get rid of because nobody took their property with them on the way out. So that's kind of an assessment. What's next now that we've closed this shelter? We continue to look for space, which is a challenge. This is something that has been going on for months now. It's been going on since the very beginning of COVID, when we had to increase our footprint in the shelter system because of social distancing. You may remember we had to move people out of Cannon, and we moved them to the library downtown because it was being renovated and we had space there. We then moved, when that was no longer available, we moved to the arena for 3 months as we continue to offer social distancing during COVID. And then we ended up at Mission, where the Way Out Center is located, operated by the Salvation Army. And so we have continually, through the last year and a half, looked for other options. This is not easy work to do. And we're continuing that work as we speak. So we hope to have a location at some point and a new building that we can use for these emergent needs, whether it is cooling centers or safer air centers or warming centers during extreme weather. And we are exploring other partnerships so that we can offer that 24/7 shelter space with the supportive services that is absolutely needed for us. I want to answer some questions that we get frequently to the city through email and constituent phone calls, and even from council members. And we have 2 new council members that just started at the beginning of the year. So I'm just going to go through a list of these questions, and you may have some questions beyond this, which I'm happy to answer as well. But we're asked why we didn't extend the temporary shelter another week. We operated it for 2 weeks. We weren't able to extend it any further because the PFD had to make those repairs. Those repairs are ongoing. The $90,000 that I mentioned, those repairs are ongoing because they have events that they want to be able to continue to hold at the convention center. So we needed to give them time to make those repairs. The challenge in finding another location, lots of challenges. The biggest one is pushback from neighborhoods. A lot of people know that we are a compassionate community and people want to help in this issue, but we've received pushback from almost every single neighborhood that we wanted to locate a shelter in, whether that was the grocery outlet, whether that was Cannon Street, or whether that was Mission, the Way Out Center on Mission. We've encountered pushback every single time we try to locate a shelter somewhere within the city. So that's absolutely our biggest challenge. What's the plan regarding emergency sheltering that's supposed to be published September 30th and where? We put that plan in September on our website. You can still find it there. It's located under the hazard sheltering section of our website. We were able to make sure that the community knew what the plan was. And if you want to access that, that's still on our website today. What are the average number of homeless individuals in the city who are unsheltered on a nightly basis? That's a question we've been trying to answer for a very long time. Our point in time counts that's required by the federal government will take place January 27th. That's next week. That number is what gives us the best estimate for what the unsheltered population looks like. The last count was in 2020. In 2021, the CDC recommended that cities not do a count of their unsheltered because of COVID. And so we're hoping to get better assessment on that this year. Why is there no location available for a warming center? Again, the challenges of finding the location are ongoing, never ending, and that work continues. When does the administration expect to have a permanent location in place and ready to utilize? We are actively looking right now for a temporary space while work continues for a permanent space. So when we have something confirmed, we'll definitely be able to let you know. But right now, nothing is confirmed. That work continues. Why was the convention center closed prior to a new location being identified? Again, I think I answered that question in that we had to close it for repairs before we were able to find a new location. That work continues. What efforts did the administration take to find a new location during the 2 weeks that the convention center was open? We were always working on that. In fact, we went out to a number of brokers. We talked with a lot of stakeholders. And as we were closing that shelter, we asked the public, give us your ideas. This is not something that the city can do on its own. This is something that we're all going to have to work together to find solutions for. And The ideas that have come in to the mayor's office so far, we're taking a look at, but right now, nothing that is that we can solidify or announce. What communication, transportation, and safety procedures were followed in preparation for the closure of the convention center? So we made it very clear to the guests who were there. They had several days' notice that we were going to have to close on December 9th. The Guardians Foundation offers transportation. They were able to move people who wanted to be sheltered into spaces within the regional shelter system. So that took place. And we also communicated out to the community that we were closing that shelter on December 9th and that we were looking for more space. Why were Catholic, was a new one for me. Why were Catholic Charities and the Intramodal Center not utilized at the closing of the convention center? We're in constant contact with Catholic Charities. We knew that they had a COVID outbreak at House of Charity and had already reduced the number of beds that they had there from 135 to 100. We were not notified by Catholic Charities that there was any possibility of more beds there. And the Intermodal Center, we had looked at the Intermodal Center on a number of occasions, but because we have tenants in the Intermodal and it's a transportation site with active rail lines behind that building, that became a real safety concern. So we have not utilized the Intermodal Center for that. What is the history of the 100 beds at the Way Out shelter and how were they redistributed within the permanent system? Well, the 100 beds at the Way Out shelter. So the question really is about when we closed the Way Out shelter to do renovations there because we wanted to reopen it in December as a higher barrier bridge housing type of operation. Those beds weren't new beds in the system. Those beds really were part of the footprint that we had to increase within the shelter system because of COVID and social distancing. So those weren't new beds added to the system. That was just increasing the square footage that we had to provide to continue to offer the beds that were already in the system. So those weren't new beds that had to be replicated elsewhere. People were still operating under COVID guidelines and social distancing. So that was more of offering more square footage to be able to continue to offer the beds that we already had. And then what are we doing to address the immediate danger and potential death for unsheltered individuals? And that's a really good question. That happens, that's a question that we ask during inclement weather and just year round. We continue to work with our outreach teams, including our own teams here at the city, code enforcement. Anytime that we do cleaning under viaducts or along the streets, we bring in outreach so that we can try to, as we're cleaning, connect people who are on the street to the services and resources that we already have, whether that's shelter space, whether that is mental health services, or whether that's substance abuse treatment. So that work is ongoing. I will just say one of the things that I've learned just with the regional system that we have and a gap that we have right now is, for example, our 24/7 drop-in temporary low barrier shelter at Cannon. That shelter has 80 beds and it is always full. We need to do a better job of moving people there to services. That is not meant to be a place for people to permanently live. That is an emergency drop-in shelter. And we need to be moving those people into programs and into spaces where they can get help so that they're not just staying there and we're not just filling those beds with the same people every single night. We need to do a better job as a community in doing that, whether that's navigators or more outreach teams that come into these shelters and survey people and work with people to connect them to services. That's something that we really need to do and needs to be ongoing and we can improve on. So that's my presentation. If anybody has any questions, I am open to answering any other questions. And I've got Eric and I've got Chief Schaefer here too, who might be able to answer questions that could be directed toward them. So I see Adam has a question. Adam Shanks from the spokesman.
Hey, Mayor. Thank you for doing this. I'm wondering if the high usage of the temporary shelter at the convention center in any way changes your perception or understanding of the notion of shelter resistance. You know, did this make you reassess whether or not people we see in encampments downtown are actually resistant to shelter, or just haven't been able to find the right shelter?
Well, I think that's what we saw, Adam, at the convention center, is that a high number of those who accessed the convention center during the extreme weather are those who are reluctant to go to shelters or even seek out services. Because as we were closing the convention center, when we tried to connect them to other services or shelters, there was no interest on their part to access those beds. And I would just say, just the behavior that was exhibited by many of the people, the guests who were there, was an indication that they don't know how to use facilities that are indoors. When you're using a banquet chair as a toilet, I think we have some real serious behavioral issues that we need to address within people that we're trying to help. And that was exhibited clearly during the 2 weeks we operated the convention center.
This might not be a question for you, but I'm wondering if the staffing ratios at the convention center were comparable to that of, say, the permanent shelter at Cannon Street.
Well, it was run by the same provider, so I would assume that that was the case, but maybe Eric or Chief can answer that better than I.
Yes, I can, Mayor. Thank you, and thanks for the question. You know, it certainly is as we saw some of the numbers, you know, increase a little bit. I think, you know, higher those first few days than we had initially expected. We had to work with the Guardians to kind of ramp up, I think, their ratios, but I think that was just an aberration of a day or two until we got those additional staffing in place.
I think I saw Daniel, your hand up next, unless Adam, you had any other follow-up questions?
I do, but I'll relent for now.
Okay. Daniel, I think you were next then.
Yeah, just I'm just sort of wondering. So, you know, we had asked about in April of last year, I had asked about, you know, what are we going to do to make sure that we're not in this situation where we're, you know, kind of trying to kind of scramble to find a warming center. And you'd said that you know, you're going to be putting out the RFP to provide a day shelter during the summer months, and then pivot very, very quickly with the same provider to become a warming center in the winter months. So we won't be in the position of having to stand up a warming center on the fly. We'll be using the same operator. I guess I'm just trying to understand, like, how are we at this point again, where it seems like each year we have, you know, the administration says we have everything under control, and then the you know, social service providers, the homeless community is saying, I don't think there's going to be enough, and then it turns out there's not enough. Why are we in this situation now that you didn't think that we'd be in back in April?
Well, we were able to do a lot of things within the existing shelter, Daniel, and that was things that would provide more continuity and more predictability. So the first thing, as you mentioned, was Cannon, which was typically a warming center seasonally. Offering that up as a 24/7 shelter with a year-round contract was going to provide us more space so that we wouldn't have to ramp up and ramp down. Also, buying down the barrier at Truth Ministries to add more spaces there, the young adult shelter, add more spaces there. You know, we're learning as we go. I mean, those are all big advancements and enhancements that we've made in the system. But after the council did pass their ordinance for emergency or hazard sheltering, whether that's cooling centers, safer air centers, or warming centers, being able to have a space where in the case of an emergency, we could open up and we would already have an operator in place, proved to be an extreme challenge. Finding buildings and operators that on a dime can come in and stand up a facility is extremely challenging work. And we're continuing to find buildings where we can do that work when we need to. When this extreme weather came in below zero, we knew we had to do something extra, and we didn't have something in place. Even though that work continues to find buildings where we can do this kind of thing, we just don't have that space available. And in fact, one of the things that we did before we closed the convention center was we used an operations management opportunity to go to the county and to the state to ask for help in locating buildings. And nothing has come forward. County doesn't have anything. They kicked it up to the state. The state has not offered us anything. So that work continues, and it's extremely challenging. But I made a call to the PFD and I said, hey, we've got this weather and we need to figure something out. Can we use the convention center? And that's how we ended up at the convention center. And we are still looking for space.
Considering that there has been, from 100 to over 300 people utilizing this space, in retrospect, does it cause you to reassess your original kind of feelings about the council's resolution about, requiring this sort of space? Is that something that now looking at this need, do you think, hey, maybe this was actually something that was necessary?
Well, and that's why I have a new low barrier shelter in my 2022 budget.
Mm-hmm.
Absolutely, we need more space.
Is that a change from where you were previously? And I guess what shifted your view on that? If
Well,
so?
I think Daniel, what my position was, even coming into this office, was that I didn't think we should continue to build more low barrier shelters.
Mm-hmm.
So that comes at a huge high cost to our taxpayers. But I have reassessed that philosophy and see that we do need more low barrier space. And that's why I have another proposal for a shelter in this budget year. And we are actively looking temporarily for more shelter space and permanently for more shelter space. I've learned a lot since I've come into office on this issue. It is far more complex than I or any of us have any idea, except for maybe the people who are doing the work 24/7. The service providers and the nonprofits. I mean, we're not going to wave a magic wand and solve this issue. This is extremely complex. And even those who are passing the laws that are requiring me to do certain things, I don't think understand how extremely complex and challenging this is. Otherwise, we'd have it all figured out by now.
Thanks, Daniel. Rebecca's been waiting patiently. I think she had her hand up next. If we can go to Rebecca.
Hi, Mayor Woodward. I had a question about, so the city has, a list of standards it needs to meet as far as this new building. As time goes on and really cold temperature continues, could the city potentially compromise on the 20,000 square feet, the locating in a neighborhood, and some of those other must-haves that are on this list, even if it was only for, a couple week temporary solution?
I mean, I think we can always be flexible. In an ideal situation, though, if we can find a building that we can use for that's a little more long-term than just temporary, that would be ideal, because moving populations from building to building and changing up what we offer is difficult. It needs to be something that I think is more consistent and more predictable. So that's what the goal. That's why the goal is to get a space that's big enough so that we can utilize it for whatever hazard sheltering situations we find ourselves in.
With the city law being, when it hits 32 degrees and that 90% occupancy, I mean, will you be potentially in a position where, you have to compromise some of those things just to find a space to meet that requirement?
I don't anticipate that. I mean, I think we have to be flexible and meet the intent of the ordinances as closely as we can, while providing people space that's safe during inclement weather. And that's always the goal. And that's the work that we're doing right now.
Thank you.
Mm-hmm. Thank you.
Thanks, Rebecca. Adam, I know your hand is still up, but do you have additional questions?
Full disclosure, I just forgot to lower it, but yeah, sure, I do have more questions. You mentioned having to get people into services and sort of move on to alleviate some of the pressure on the shelter system. And I guess my question is, into what services and programs and housing can these people move on to? I know I've written about rapid rehousing, and what I hear from service providers is that the housing crunch is really trickling down to the very bottom, and there's just no places for people to go. So I
Yeah.
guess, what is that? What is the long-term answer there?
I think Eric Eric is so well versed on this just in the short amount of time that he's been our interim director at NHHS. But I think, Eric, you can speak to that. That is the huge challenge. I mean, that's why housing and homelessness, dovetail off each other and are part of the issue. So, Eric, if you want to take that one.
Thank you, Mayor, and thank you, Adam, for the question. And again, I'll try to do this briefly because there is a lot obviously wrapped in that question. But it is, I think, important to understand that this is kind of like an ecosystem. And I think to reinforce one of the earlier points is that compression, that you mentioned within the system is one of the reasons. Most of the shelter providers that I've talked to and started building relationships with over these past couple of months have indicated that there's potentially double digits within their groups that are ready to move on or could really go into that next place. But they're just not available, and even those that have like universal vouchers, the Go Anywhere vouchers, they're having a hard time getting them accepted, and the sub 1%, vacancy rates, et cetera, add to the problem. So we're trying to look at this from an ecosystem standpoint, in terms of everything from rental assistance, which we've seen obviously be one of the best tools we can use to keep people in their homes, all the way through the sheltering perspective, all the way to kind of affordable housing and market rate housing, which there's not even enough market rate housing. So I think the more we can do and start pulling some of those levers all at the same time, and we've obviously had the affordable housing groups meeting, and looking to activate, funding that's available there. We've been doing reviews of the governor's latest, $800 million proposal in terms of how to activate things there. And one of the things that we're actively looking to do, along with our Continuum of Care board, and our CHHS board and the county's equivalent board, is basically look at a joint planning session that we're going to be starting, at the end of January, where we look at that overall ecosystem and we start talking about goals and needs across the system. And one example I will give you, and I think this is also a kind of a cornerstone of the governor's initiatives that he's put out, is the need for that permanent supportive housing, or basically what we're seeing from this population is that there's always going to be the need for some help. And so I think how we can try to better activate some of that other housing so it gives people the ability to progress. The Way Out Center in its current transitional housing mode, as that gets up to full capacity, will also help basically, people move on, in the system. So I think that really what this needs to be is moving several of those levers at the same time, and to a degree getting creative, with the solutions and the funding across several of those different areas. Because I think that one of the artifacts and challenges that we certainly learned through this process is that we just opened Cannon within this last year. I think sometimes that's easy to forget, but if it's continually at capacity, then that doesn't give us the flexibility that it was originally intended for. So I think that we've got some great work going forward in terms of trying to plan, I think, for that better piece. And now we do have to kind of respond to this kind of near-term piece. And I think doing that emergency management request, up to the county and the state, was certainly one of those things to ask for some help. So I'll stop there. And if there's any following questions, or Mayor, anything else you'd like me to cover, I'm happy to do so.
Well, I'm glad you mentioned the Way Out Center, because the Salvation Army does really good work on being able to find, with their relationships and partnerships that they have, they're able to find housing for people who are exiting their programs, like the one we're just starting at the Way Out Center that opened in December. Though we're in full capacity, we can get 60 people into those beds and directly connected to services that then get them to a place where they can live on their own through the partnership Salvation Army has. That's a fabulous new program that's come online. And I know this, I'm very thankful for the city council that has funded pretty much every ask that we have given them when it comes to homelessness. But the Way Out Center is one that we have not been able to get over, get over the finish line with them. We need to fund this shelter so that we can help people who want to exit homelessness and into housing. And we still have not funded that shelter on the city side. So that would be my big ask of the city council.
Esther, I see your hand up. If you want to go next.
Yep, Brian, thank you. Mayor, thanks so much for taking this time. I just want to follow up on your comment that every single neighborhood you've tried to find space in to move out of the downtown corridor has said not here. How are you going to find space when you're receiving so much pushback about where these spaces can go? No neighborhood wants it there. How are we going to fix that if everywhere you've turned, people have said no?
Well, it doesn't mean we can't do it. It just shows the magnitude of the challenge when we try to do it. We can always find a way. One of them is public engagement. I think community neighborhood public engagement is extremely important. Our service providers will even tell you how important that is. But again, my goal is to locate a facility that is not in a neighborhood, not in a school, and not directly connected or close to business sectors. And I think that that'll help alleviate some of it. But we will definitely be very engaged in whatever neighborhood or location, I will say, that we find that would be suitable for a temporary shelter.
All right, I'm not seeing any more hands, so I'll go put out one last. Oh, I spoke too soon. Ian, your hand's up. Go ahead.
Thank you. Mayor Woodward, I was just wondering if you had a chance to see the letter that the city council sent out before the press conference that they are planning to vote on tomorrow about whether or not to send to you.
Just briefly, I didn't get to look at it. It just came out right before this. And so obviously that doesn't present me with a lot of time to look at it. So, but I did notice that they are committed to funding whatever we need on this issue. And I would ask them to then fund the Way Out Center operated by the Salvation Army so that we can activate all 60 of those beds and continue our work on this issue.
And I was also wondering, I know you didn't have a long time to read it, but part of the letter, they say that the administration isn't following some of the ordinances they put in place, including the closing of the emergency warming center when it was still below freezing. I was just wondering if you had a...
No, we are actively looking for another temporary shelter. We had to close that. We had no choice. So that work continues.
Thank you.
Mm-hmm.
Daniel, I see your hand up again.
Yeah, I just wanted to ask about the, the Browns Addition Neighborhood Council signed a letter a couple, months ago, or maybe last year sometime, just sort of praising the Cannon Shelter for praising the Guardians for the operation there. And so it sounds like that at least, in the case of the Browns Addition, the Cannon Shelter has at least eventually become kind of welcome and even celebrated for the way they've been able to operate. What lessons do we have from that center that we could apply to other neighborhoods, or why has that been successful in terms of the just the reaction from the neighborhood?
That's a great question, Daniel, and it's because of, I would say the operator. He didn't start out that way. We had lots of complaints about Cannon and the way it had been operated in the past. And I'll tell you, I think Mike Shaw with the Guardians Foundation will tell you that they've learned a lot in their evolution of providing services for homeless. And the way that they operate Cannon is an illustration of that. As you mentioned, the neighborhood council wanted them to stay as the provider as we, renew these contracts every year. because they're so happy about the way Cannon is being operated. And that's because of the neighborhood engagement that the Guardians does within the neighborhood. Their security team that even goes beyond a 2-block radius of that shelter to engage the neighborhood and to look out for the neighborhood. The cleanup that they do. One of the stories that I got from the Guardians was that on a daily basis, they have people, not just their staff, but residents who are using the Cannon shelter, if they volunteer to do so, clean up garbage and litter from Brown's Addition, basically through downtown. It's that type of active engagement and ownership of where you're operating a facility and making that a better place. And to me, that they've become a model provider of what we expect of our providers when we give them taxpayer money to operate these facilities. Does that answer
Thanks,
your
Daniel.
question? So.
Yeah, no, sorry, I was just yeah, I didn't mean to like give you. I'm still on. I'm still listening. I was just
Yeah.
no, I
yeah.
appreciate it. Yeah, I mean this is a wicked problem, right? As they say, and I'm just always, anytime there seems to be some element of success, that seems to be the part of the news too. And I'm trying to understand why that is so it can be replicated.
Yeah, absolutely.
Thanks, Daniel. Not seeing any more hands. One last call for members of the media. If you have any questions for Mayor Woodward, for Chief Schaefer as the incident commander, or Mr. Finch as our division director for Neighborhood Housing and Human Services, please raise your hand or open your mic. All right, seeing no hands and hearing no further questions, thank you very much for attending today's news conference. We appreciate the time. If you have any follow-up questions, please let me know, but otherwise we will conclude the conference for today. Thank you.
Thank you.